Hi everyone, very good evening guys. I hope I'm audible and visible to all of you, and welcome back to the second part of this particular session or series or marathon, if I may say so. And I hope all of you have benefited from yesterday's session as well, where we discussed, which was quite a power-packed session, but I feel today is going to be all the more power-packed because the kind of topics that we are going to discuss are definitely going to be not only important but definitely a lot of content that we have to discuss in a very short time in a very crisp and concise manner. So I hope that if by chance there was any slumber in your preparation, these sessions are helping you getting back on track and without any delay. And one more thing, please don't make any notes because you know that we are sharing PDFs with you already. So this PDF will also be shared with you, so you don't have to waste any time in making or jotting down any notes. Just listen and learn. Okay, having said that, let's begin right away. So today the plan, I'll quickly brief you on what exactly have I planned. So obviously a lot of students had written to me about hematology being one of the problematic areas. So I decided that let's keep our core focus on hemat for the day, which basically means that WBC questions have started coming a lot in the paper, and those include the leukemias and the lymphoma questions, right? With too much of genetics, photos, how should we solve MCQs, all of that we'll be dealing with. So yes, without getting into leukemia, lymphoma directly, the first picture that I want to start, which is a much expected photo, and the same picture has been coming so many times in the exam earlier, and that is a picture of all the 5 WBCs that you have in the blood. So all of us know the 5 WBCs. If we write it down, it is NLMEB, right? NLMEB, and that is, there's a very famous mnemonic also for it. So this is neutrophil, lymphocyte, monocyte, eosinophil, basophil. And how do we learn this? You have to learn it in the same order. Why? Because this is from maximum concentration to the least concentration in the blood. So maximum is neutrophil and least is going to be a basophil, and there's a mnemonic that is known as never let monkeys eat bananas, right? So never let monkeys eat bananas, that is how you learn NLMEB. So I'm going to come back to this picture in exactly a minute. First let me teach you these 5 cells and let us come back and test our knowledge. So the first cell that you have, which everyone is aware of, is what is going to be a neutrophil. How do I identify a neutrophil? I will look at the lobes. 3 to 5 lobes wala cell, that is going to be a neutrophil. So now keep telling me the theory also. If I get more than 5 or more than 5 lobes, what is that known as? If the lobes increase, then that will be referred to as a hypersegmented neutrophil. Right? And hypersegmented neutrophil is seen in which anemia, guys, that you all know? That is seen in B12 deficiency. Very good. That is megaloblastic anemia. Amazing. So yes, now you've done the normal also, and then you've done the disease also, the hypersegmentation also. That is the first one, neutrophil. What is the next one? The next one is the most simple looking cell, and that is going to be a lymphocyte. There is nothing fancy about a lymphocyte. Simple. Aisa round wala cell hoga, round nucleus. There is nothing elaborate about it. Simple looking cell is going to be a lymphocyte. Okay, let's move forward. The next cell that we have is referred to as the kidney shaped. As soon as I see the kidney shape out here, as soon as I see a nucleus which is going to be like this, like a kidney, I know I'm talking about a monocyte. Monocyte is that kidney shaped nucleus. That's the way of identifying it. Okay, the fourth cell is actually the most different looking. They call the color of this cell is only different. Ma'am, the only cell in the blood which is going to look orangish, that is going to be an eosinophil. So please note, if you get a cell which is showing you these orange color granules, that is an eosinophil. The story is not over. Eosinophil has everything very fancy. It's a pretty pink cell. Okay, it's a pretty pink cell. And look at the nucleus. The nucleus is going to be like this, like a spectacle. Some people call it spectacles. Some people call them headphones. Apna imagination basically, but there have to be 2 lobes is what I want to tell you out here, right? That is an eosinophil. And the last cell is the BBB. What is BBB? The last cell is a basophil, and everything about a basophil is going to be blue and black. So look at the cell, it's got all these blue big dots. So these blue black granules, that is going to be a basophil. So see, you've identified all the 5 cells. Let's get back to that image and do our test also complete. So let's complete our test that we have. So let me ask you randomly, okay? Not in any order, I'm asking you randomly. What is this cell? This simple looking cell in the center, what would you label this? A quick answer. That's the very famous, simple looking, ma'am, simple round cell, simple round nucleus, that is a lymphocyte. Amazing. If I ask you what is this cell? count the number of lobes that it has. I can see 1, 2, 3. So the 3 lobes one, the 3 to 5 lobes one becomes the neutrophil, right? Now going on to this cell. This cell has that BBB. Can you see the blue color dots? So the blue-black color dots, that is going to make it the basophils. The most different looking cell over here, this is the easiest to identify. Why? Because this is going to be orangish. Any cell which is orangish is always going to be an eosinophil, the only orange looking cell. And then what am I left with? I'm left with this kidney out here. I'm left with this kidney out here, and the kidney is going to be the monocyte. So now this is the only picture you will actually see on the net also, which has all the 5 cells in the same slide, right? So yes, this is taken care of all of that, but there's one variation. I want to teach you one cell that comes in microbiology, which is very, very famous. Ye wala cell, very famous cell of microbiology that you have. It is actually a lymphocyte. Actually, it's a lymphocyte, but there is some change that has happened into a lymphocyte. Lymphocyte mein kuch change hua hai. There has been a transformation. And this, if you look, I've got the reference image also. It's like a ballerina skirt. It's like a ballerina skirt. So look at this cell, ma'am. Suddenly the lymphocyte has become a ballerina skirt-like of cell. These are referred to as the very famous ballerina skirt appearance. This is a question that you get in the paper. Ballerina skirt appearance seen with Epstein-Barr virus. Excellent. And what is the infection for Epstein-Barr virus? The infection that I'm talking about is infectious mononucleosis. So simple. If the lymphocyte is looking simple, round, I'm just going to call it a lymphocyte. But if on the other hand, the cell starts looking like this, like a ballerina skirt, then I'm going to call it a ballerina skirt appearance. Very good. Having said that, cell identification ho gaya, right? But the story is not complete till the time I don't identify what is this cell. That's the next test for all of you. I'll highlight 1 or 2 cells. Can you tell me what are these? Let's see who answers those. Yes, so we can very well see. If you want, I can zoom in for you also. You have something that is lying inside these cells. You have something which is putting up inside some rod kind of a structure. Very good guys, as soon as you see an OR rod, matlab if this is given in the question, I'll be so happy, because then the answers become so simple. That is an OR rod. Which is the cell which is OR rod positive? That is a myeloblast. So the next question that comes in the exam is, how do I differentiate a myeloblast and a lymphoblast? Blast matlab slowly I am going into the leukemias wala category. So I'll show you 2 pictures. You will easily identify. The story is that if you are seeing an OR rod, if an OR rod is visible, then that is a myeloblast. And if the OR rod is not seen, if the OR rod is absent, then that is going to be a lymphoblast. So simple, you can look at the cells, look at these, there are so many rods present. When there are so many rods present, matlab that becomes a myeloblast. And here I don't see, yahan pe everything is saaf, everything is clear, right? So I don't see any OR rod. That basically means that that is gonna be a lymphoblast. Okay, now why did I tell you this entire story? Because if myeloblasts are more than 20%, what is your diagnosis? If these cells come out to be more than 20%, your diagnosis becomes acute myeloid leukemia. And if lymphoblast comes out to be more than 20%, then your diagnosis is ALL. So what did I analyze? For any acute leukemia, guys, for any acute leukemia, whether it is AML or ALL, for any acute leukemia, the blast cutoff has to be above 20%. So myloblast above 20% hai to AML, and if lymphoblast is above 20%, then that is ALL. So now all our basics have been discussed very nicely. Now we will move on to one question. All of you are going to read it. It's lengthy, but these are the kind of HIMAT questions you get in the paper, okay? So everyone read and let me know whatever you feel are your answers. So I'll give you a moment. We can have a quick overview of this question, and you have to tell me something related to chromosomes. So yes, which of the following chromosomal abnormality is most commonly associated with whatever patient you have? I'm getting 2 answers. Now HIMAT, I understand that, you know, there's HIMAT ke saath problem. What happens is, in medicine you feel you study it in path, and in path you feel you study it in medicine, and ultimately you keep passing the ball from here to there and ultimately don't study it in detail anywhere. We are all guilty of doing that at some point of time. So don't worry, we'll study it in a manner that your medicine also is gradually getting covered. Most of you said 920 922? I really don't know why, because that is not the correct answer. Let's read it together. See guys, firstly, if you were talking about 922, which is not the correct answer, means you were talking about Philadelphia chromosome. And if you were talking about Philadelphia chromosome, this means you were talking about chronic myeloid leukemia. Chronic myeloid leukemia in a 5-year-old, even as a pathologist, I will think a million times before giving that diagnosis. Very, very rare for it to happen in a 5-year-old kid. So 5-year-old mein, if my general, think of common things first in the paper. 5-year-old mein, I would have always thought of ALL first. Then I'll start reading. Look at the history. There's a history of loss of appetite, fatigue, irritability and low-grade fever. Also, there are bone pains, especially in the lower limbs. There is pallor, splenomegaly, lymphadenopathy. So definitely the entire body is getting affected. It's not a single system disorder. That is how blood cancers come. Blood cancers will have a widespread distribution in the body. Did you notice the hemoglobin is 8, means the child is anemic? Number 1. Then you realize that the platelet count is 90,000. Ma'am, hemoglobin is also low and platelet count is also low. And they have said that bone marrow shows you 30% of lymphoblasts. Guys, right now you had only told me yourself that when the lymphoblast variety goes above 20%, what is your diagnosis going to be? Your diagnosis is going to be ALL. Right now you only told me. More than 20% diya na, examiner has mentioned 30%. Lymphoblasts are also mentioned. This means it is a case of ALL, and that is fitting so well with my age also. In 5-year-old kids, I expect ALL only to be the leukemia. Now, what is the most common alteration that you see in ALL is hyperdiploidy. Hyperdiploidy is what you get to see most commonly. So what we'll do, we are quickly going to analyze what are the different genetics that you see in ALL and which of them are good and which of them are bad. So first and foremost, देखो, how do I learn this? It's going to be a lengthy list and it's troublesome. तो easy way में याद करते हैं. What is ALL? ALL has total of 3 alphabets. ALL, ma'am, 3 alphabets. So anything that is to do with 333 is going to be good, okay? So if I say that someone is having any trisomy, trisomy means 3 chromosomes. Trisomy of chromosome 4, 4 plus 3, 7. 7 plus 3, 10. सब कुछ 3 चलेगा. So trisomy 4, 7, 10. Because these are 3 chromosomes, it is good. If someone asks you translocation 1, 2, 2, 1, again 1 plus 2 is also 3, 2 plus 1 obviously is also 3. So ये 3 wala things, ma'am, this is also good. And if someone asks us hyperdiploidy, see diploid matlab 2n, all of us are diploid, all of us in class today we are diploid people. Hyperdiploid means more than 2n, matlab again more than 2 is what? 3. So anything coming across as 3, 3, 3, whether it is 3 wala trisomies or it is 1, 2, 2, 1 which is also coming out to be 3, or it is hyperdiploidy, all of that is good. And let me tell you, hyperdiploidy is the most common genetic alteration of ALL, and that is the question that I had asked you over here. After this, ma'am, whatever the examiner will write, if the examiner writes translocation 922, if the examiner writes something like hypodiploidy or any other XYZ thing written in the paper, ma'am, baki sab becomes the bad prognosis. Now coming back to your question, all of you are like that, ma'am, when we are doing the prognostic factors and we've done the genetics part of it, let us do the other prognostic factors. And this was the recent, I told you, right, that this year papers you have to study and go, and every paper this year had a prognostic question on ALL. So remember, first is going to be the age. So please remember, a 2 to 10-year-old female is good, but less than 1-year-old, more than 10-year-old, matlab very, very small, very, very big, or any normal range is fine. 2 to 10-year-old kid is fine, but a very, very chota bacha or a bacha who's a little bigger and who's male, that is going to be bad. So remember, a very, very small or a very, very old male, that is going to be bad. On the other hand, everyone knows for ALL we have 2 classifications. What are the 2 classifications of ALL? Ek hai FAB. FAB matlab French and American and British. Okay, so there's a French, American, British classification, and then there is a WHO classification. French, American, British classification says L1, L2, L3, in which L1 is good, L3 is bad. L1 is good, L3 is bad. WHO says no, there is something called BALL and TALL. B is badhiya, B is good, T is bad. So now my question to you is, why is T bad? That is the question that you'll get in the paper also. Why is TALL bad? Because T for T, remember, TALL is the one that goes into the tissues. What tissues? Top of the body, that is, it goes into the brain. Imagine blood cancer going into the brain, obviously it's going to be bad. What else? It can go into the mediastinum and it can go into the testes. So put your common sense into it. Obviously, if a blood cancer goes into all these tissues, it's obviously going to be bad. And it's going in the testes, so which gender is going to be bad? That is the reason that I told you that males have a bad prognosis, because this cancer can go into the testicular tissue. I hope that is okay with everyone. So we've got brain, mediastinum, testis. So now, how else could I have given this question to you? Coming back, dekho. Isme to I just asked you a simple thing, that which of the following chromosomal abnormalities most commonly seen? Now do you know the answer? The answer was characteristically hyperdiploidy, right? But now if I would have asked you indirectly that apart from this, in this 5-year-old boy, there is involvement of testicular tissue noted as well. Which kind of ALL would you call it? Testicular tissue or brain tissue or mediastinal tissue? Some tissue thing will be written. Then I would have called it as TALL. That's another way of how the question is going to come. I hope that's okay with everyone. Acha, now tell me quickly. There are 4 things written in front of you. You will tell me which are the good ones and which are the bad ones for ALL. Trisomies. Are trisomies good or bad? All 3 letter things. Trisomy is a good prognosis. Trisomy 10 is also going to be a good prognosis. Hyperdiploidy also comes under 3. All the 3 things are all good things. 922 is going to be what? 922 is the bad prognosis, right? Okay, so first question, I hope it's a good start. Now I'm going to go into a little bit of a medicine question. So here you go with the next one. Don't be in any hurry. These questions are time consuming, so take all your time and answer well. There's a 15-year-old boy who's got a history of gum bleeding, conjunctival bleeding, skin bleeding, lots of bleeding. Investigation revealed hemoglobin has gone very down. TLC is 26,000. Platelet has become very low, 35,000. Prothrombin time is going to be a 20-second and APTT is a 50-second. Diagnosis is given. It's a case of AML. Which AML am I likely to find over here? Everyone, okay, finally, we are like, wo warm-up wala question tha, that we didn't get, everyone didn't get it right. But ab warm-up ho gaya, ma'am. Now we are back in action. All of us have given the right answer, and that is C. Most of us have given a right answer. So basically, that is what happens in the exam also. You know, the first 1 or 2 questions, you're very, very scared. And you know, you feel a little nervous and jittery and shaky hands and all of that. But after 1 or 2 questions, you settle down, and the earlier you settle down, the more confident you will start feeling in the exam also. So kya hua iske andar? If I go into this, there is too much of bleeding that is happening in the patient. Bleeding matlab conjunctival bleed, gum bleed, rash bleeding, sab bleeding type of history hai. Look at, because so much of bleeding is happening, so hemoglobin will obviously go down because of the blood loss. But I saw the platelet count is low. What is the, first tell me normal platelet count. Normal values you have to know. Normal platelet count. Normal platelet count is 1.5 to 4 lakhs. Even up to 4.5 lakhs is fine. Normal platelet count is 1.5 to 4 lakhs. And here it is not in lakhs, it is in 35,000. So the platelet count is obviously very, very low. Then the next normal value, prothrombin time. Guys, prothrombin time and APTT, PT and APTT, sometimes they give you the normal values. Like dekho yahan pe what did they say? They said prothrombin time has a control of 13 seconds. Matlab they have given you a normal value of 13 seconds and patient ka prothrombin time is 20 seconds. This means the prothrombin time is elevated. Usually it is 11 to 16 seconds. That's the usual range, 11 to 16 seconds. Next, APTT. APTT is usually 35 to 45 seconds maximum. This is the overall maximum range. Yahan par APTT is coming out to be 50 seconds, which means APTT is also elevated. You will say, ma'am, one problem is that platelet count is low. The other problem is that the markers are all elevated, PT, APTT. That's the classical profile of a patient going into what? That's a classical profile of patient going into DIC, and which is the only leukemia ever known to go into DIC, and that is APML. So I'm going to talk about this promyelocytic leukemia with a picture. Remember, the only leukemia The only leukemia which I can have which is associated with DIC is AML-M3. And what is the other name of AML-M3? APML. That is what was written in your question. Acute promyelocytic leukemia. Acute promyelocytic leukemia, and this is what goes into DIC. So whenever you get a DIC wala question, answer has to be AML-M3. And what is this picture that you're seeing over here? Ma'am, you had shown us one OR rod. Suddenly I'm seeing bundles of OR rods. Just zoom into this and see, look at them. All the OR rods are going as a crisscross, crisscross. So whenever I start seeing bundles and bunches of OR rods, that kind of a cell is referred to as a faggot cell. So that is another question that you get for AML-M3. Then finish off the medicine part also. So pehle kya pada? Medicine mein you studied that this is the only leukemia with DIC. In pathology, what does it show you? It shows you the faggot cells. You will tell me what is the genetic alteration. AML-M3 shows you a translocation called 1517 with PML-RARA fusion. PML-RARA fusion. So this is one very famous question that you get. It is translocation 1517 with PML-RARA fusion. So now tell me the treatment also. I don't want you to know the full form, but if you ever noticed what is RARA? RARA is retinoic acid. Basically, ma'am, problem is in retinoic acid. That means that when I will have to treat this patient, I will have to treat him also with retinoic acid. Retinoic acid matlab vitamin A. So the treatment is ATRA, all trans retinoic acid and arsenic trioxide. Arsenic trioxide. So that is the next medicine question that you get, which is the only blood cancer treated with vitamin A. Imagine, cancer ko treat kar rahe hain with vitamin A. That is all so simple. Ma'am, problem was in retinoic acid. So for treatment also I gave retinoic acid. ATRA and arsenic trioxide is what we are going to give. I hope everyone's okay with this. All questions of AML-M3 have been sorted for you. And this was a classical case of DIC. And DIC ka dusra naam, tell me from medicine, what is the other name for DIC that you must know? DIC is also known as consumptive coagulopathy. DIC is also referred to as consumptive coagulopathy. Means everything is going to get consumed. What is going to get consumed? Ma'am, everything. Platelets will get consumed. Platelets use up ho gaye. That is why the platelet count went down. All clotting factors, factor 1, 2, 3, 4, all clotting factors are being consumed. That is why your PT, APTT was rising. Everything is getting consumed, and that is why I call it a consumptive coagulopathy. Perfect. So having said that, now let's move on to the next question which you have. I hope this one is something which is a little easier on you. There's a 47-year-old patient, a known case of leukemia, some blood cancer, who has presented with fever and body malaise. Okay. On examination, patient is disoriented to time and place. Pallor is present, so he's anemic. SpO2 has gone very low, that is 80%. Heart rate is 110. Blood workup shows hemoglobin is such a severe anemia. 3 grams hemoglobin is very difficult. And autoimmune hemolytic anemia is the category that has been given. That is the diagnosis. Which is the leukemia that is associated with autoimmune hemolytic anemia? And D is what everyone is answering. So I'll go with the majority of you. Yes. Firstly, tell me what is the full form of CLL, because that is going to tell you the definition of CLL. Chronic lymphocytic leukemia. This means now, ma'am, we are out of that acute variety. I'm out of that acute variety. I have entered into the world of chronic. Will the blast count now be more than 20%? No. Till the time the blast count was more than a 20%, I had put it under the acute variety. Now, everything is going to be less than 20%. Blast world, forget the word blast. Now, the chronic may forget the word blast. I'm not going to talk about blasts. I am going to talk about lymphocytes. Whatever I'll tell you will be lymphocyte, lymphocyte, lymphocyte. No more blasts. So first, I'll come back to this question. First, you need to know what is the criteria for CLL. So remember, everywhere I am going to use the word lymphocyte, lymphocyte. It's the word of lymphocyte now, lymphocytic leukemia. So please remember, in peripheral smear, if I take a simple blood prick kara, regular sample liya, blood sample liya, the lymphocytes should be more than 5,000. That is the cutoff. How many lymphocytes should I see in someone's blood? More than 5,000. How many lymphocytes should I see in someone's bone marrow? more than 30%. तो ये दोनों lymphocyte varieties you will have to know. The peripheral smear should be more than 5,000 and the bone marrow should be more than 30%. Finally, you will have to have 2 CD markers, and the rule is that both have to be positive. Dual positivity is going to be seen, that is CD5 and 23. So I have learned that in CLL, and gradually we are going to go to lymphomas also, so this 523 profile will come again and again. Remember, CLL sab kuch, CLL is sab kuch, everything has to be positive. So 5 also has to be positive, 23 also has to be positive. These are the 3 criteria. If you ask me, ma'am, in medicine how many criteria do you have to fulfill? All 3 criteria you have to fulfill. The peripheral smear should have more than 5,000, bone marrow should have more than 30%, and both the CD markers should be positive. All these criteria need to be fulfilled. What is the question? What is this image which all of you are very fond of, you've been answering it since 2 minutes, I'm noticing. Ma'am, these are our favorite smudge cells. But remember, smudge cells, did I write it in the 1, 2, 3 criteria? No. Smudge cells are not a part of the criteria. Smudge cells are your favorite finding, but smudge cells are not examiner ka favorite finding. Okay, the criteria doesn't necessarily have to have a smudge cell. But please remember, because I spoke all about lymphocyte, 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 I'm not talking about any other cell on this planet. I'm only talking about lymphocyte. So everyone is looking the same. That is why CLL is said to be the convent school girl appearance. Convent school girl, because convent, I mean school, everyone is in the same uniform. So everyone is looking the same. Lymphocyte, lymphocyte, lymphocyte. Everyone is looking the same. Now, why didn't they call it school boy? That is a little bit of gender bias that has been done by the author. But yeah, he's labeled it as convent school girl appearance. Okay, chalo. Having said that, now coming back to the question, ma'am, CLL कैसे बनाया? CLL के लिए here the hint given was autoimmune hemolytic anemia, because now I'm going to tell you that CLL is associated with 2 syndromes. Okay, CLL is associated with 2 syndromes, that is Richter's syndrome and Evans syndrome. I'll tell you how. See, what is Evans? I have learned Evan matlab, Evan sounds like everyone. Okay, Evan is everyone, so everyone is going to get involved. Who is everyone in hemat? Ma'am, everyone in hemat is red blood cell, white blood cell, platelet. Red blood cell, white blood cell, platelet. Everyone is going to get affected. White blood cell mein kya problem hai? That is in front of you. White blood cell problem is CLL. Plus, in red blood cells, patient will have autoimmune hemolytic anemia, which was given in my question. And someone asked me, why was the SpO2 in the patient low? Someone having a hemoglobin of just 3 grams. Survival is anyway going to be difficult. That is the reason that the SpO2 is also coming down, right? So, RBC mein hemolytic anemia, WBC has CLL, platelet has ITP. The platelet count will also go down. So, ultimately, when I say everyone is getting affected, RBC, WBC, platelet, when everyone wala syndrome is Evans syndrome. And this was actually a case of Evans, because they have told you autoimmune hemolytic anemia is mentioned and some leukemia is mentioned. That leukemia can only be a case of CLL. Okay. Now, what was the other one? There is also something known as Richter's syndrome. What is Richter's? So, you will learn it as rich. How to become rich. So, ma'am, when the day we will all become very, very rich in life means we are going to become very, very big and successful in life. Hai na? So, please remember, what is Richter's syndrome? CLL is a leukemia, blood cancer leukemia. If this goes into the lymph nodes, what do you call it? You call it SLL. SLL means small lymphocytic lymphoma. If it goes into the lymph nodes, I will call it small lymphocytic lymphoma. But ma'am, abhi it is small. If I want to become rich in life, I want to become big, bada admi. Yes, I will have to make it into a big lymphoma. DLBCL. What is DLBCL? Diffuse large B cell lymphoma. Diffuse large B cell lymphoma. So, please remember, from a small lymphoma, I am going into a large lymphoma. Basically, chota admi becoming bada admi. A small person is becoming a big person. When I say he's becoming a big person, he's becoming rich in life. That is Richter's syndrome. I hope you will remember these 2 mnemonics also. What is Richter's? Becoming rich. So, a small person, small lymphoma becoming a big lymphoma. SLL going to DLBCL. Whereas, what is Evans syndrome? Evans is everyone. Everyone means RBC, WBC, platelet, everyone is getting affected, and this was a classical case of Evans that was given to us. Okay, having said that, this leukemia also seems to be done in its summary. Let's move on to the next one. So you need to mark the false statement, one of the most expected questions. You need to mark the false statement regarding the accelerated phase of CML. I am now going into CML. So yeah, what is that? Accelerated phase of CML. Give me a quick answer. A, B, C, D. What is wrong? Okay, so yes ma'am, now we are back on track. Now you're not going to get any wrong answers from our side. So that is going to be the second wala option. Second wala option is decided out here. So quickly I'll revise CML once and I'll come back to this question. Okay, now this came as a true false question. Otherwise it will come as a clinical question, right? So if CML has to come as a clinical question, one thing that you will look out for in the clinical history is going to be a massive splenomegaly, a massive spleen ma'am. Ab ek aur cheez, the patient is never going to come to you and say that I am having massive splenomegaly or my spleen is very big. How will the patient tell you that he's feeling something big in the abdomen? Patient will come to you and say, I am having a dragging sensation in the abdomen. Something is pulling because the spleen has become so big, na? He feels something is pulling him down, something is dragging him. So there is a dragging sensation of what he's going to describe to you. That is what you call as, then that is how you correlate. Ki, acha, he's saying dragging sensation, let me palpate. Maybe this is a case of massive splenomegaly. So in our country, dekho, in your exam, if a massive spleen ka question comes, if leukemias are in the options, then your best answer is CML. And in infections are in the option. If infections are in the option, then Kala Azar is one infection which is very commonly associated. Leishmania, Kala Azar, that is very commonly associated with the massive spleen. So options dekh lena, whether this is going towards an infection wala question or whether it is going towards the leukemia wala question. Phases, ma'am, first is chronic, accelerated and blast crisis. Chronic, accelerated and blast crisis. So the first difference between these three is the blast count. The first difference is going to be the blast count. So please remember, if the blast is less than 10%, that is chronic phase. Thoda sa accelerate karo, go ahead with the acceleration, means I will, what do you mean by acceleration? Acceleration basically means that it's going a little higher, something is picking up speed, that is acceleration. So the blast count has gone up and that is 10 to 19%. And blast crisis mein kya hai? Ma'am, crisis will means I have gone into crisis. Crisis for me is always 20%. Think logically. Blast has crossed a 20%. Blast has crossed a 20%. So tell me guys, if it has crossed a 20%, do you still want to call it a chronic leukemia, or now you feel ki ma'am, blast has crossed a 20%, so maybe this CML has changed into an AML or an ALL. So basically now we've gone into the acute phase. We've gone into the acute phase because the blast count has crossed 20%. So I'll guess the video was buffering. We'll quickly have a repeat on that. There are three phases. The three phases are the CAB phases. That is the chronic, accelerated and blast crisis. Chronic, accelerated and blast crisis. So सबसे पहले the blast cutoff less than 10%. 10 to 19%, and once it crosses 20%, then it is going to go into acute leukemia. So this was the blast related cutoff, less than 10, 10 to 19, more than 20. After this, whatever will be mentioned will be for accelerated phase only. Jo bhi mentioned hoga means if they say that the basophil count is more than 20%, accelerated phase. They say that WBC count is very, very high, or they say the platelet count is very, very high, or they say the platelet count is very, very low, or they end up saying that the spleen is extremely large. I mean, whatever is mentioned after that comes under the accelerated phase, and the problem is that nothing is responding to treatment. I am giving treatment to the patient, but the patient is not responding. So tell me the treatment also, na guys. Tell me the treatment. What is the treatment? Famous drug for treatment. We have something known as imatinib. We have something known as imatinib is the drug that is given. So imagine if they give you a scenario that imatinib de rahe ho, you are giving imatinib to the patient, but the patient is not responding, right? So if the patient is not responding means no count is, ma'am, platelet count is either very high or very low, spleen is very big, basophils are more than 20%, ma'am, nothing is responding only. That means we are in the accelerated phase. Okay, having said that, a lot of you were asking me that, ma'am, what is that college girl appearance that we are talking about? And actually that was the next question that I was going to ask you. Please remember, when we are talking about college girl appearance, okay, college girl or garden party. So college में क्या होता है? There's no uniform ना. College में everyone is dressed very nicely in a pretty manner. Everyone's wearing different clothes. So which is the leukemia that shows you different cells? देखो अभी करा. This can show me blasts also. This can show me basophils also. Tell me, if the basophils are more than 20%, which phase am I in? Is it chronic, accelerated or blast crisis? So if the basophils are more than 20%, then that is going to be the blast, the basophils, very good, that is going to be accelerated. Ma'am, kuch bhi agar hoga which is extra, that is going to be in the accelerated phase. Other than that, you see so many other things. You see eosinophils, you see a phenomena known as shift to left, and that basically means that, ma'am, sab kuch dikh raha hai. Everything is seen, all different cells are being seen. Everyone is different. That is why I called it college girl or garden party appearance. So now let's do a recap. If they give me a question on CLL versus CML, CLL में तो ma'am there was only one cell, lymphocyte. That is how we had learnt it. So that is what? That is going to be convent school girl appearance. But in CML, ma'am, you are saying I'm seeing blasts, basophils, eosinophils, sab kuch. So that is going to be the college girl appearance. And this is, for some odd reason, FMGE examiner ka favorite question. Very fond of. He's very fond of this convent school and college girl wala appearance. So please remember, this is the difference that you have. But your first question is still pending, guys. That question we are going to go back to. Now let's do a true-false. They had asked me regarding the accelerated phase. Tell me, accelerated phase में is the blast count 10 to 19%? Yes. 3 phases हैं. CAB phase, blast count less than 10, then 10 to 19, and then more than 20. So yes, accelerated में blast is 10 to 19. That is right. Are the basophils 10 to 19? No, that is no criteria only. Basophil kabhi bhi 10 to 19 nahi tha. Basophil was more than 20%. So that is the false statement. That is the answer that you have over here. Let us read the other options. Spleen size is very large and nothing is responding to treatment. Ma'am, that is correct. We just studied. Platelet count is very high, not responding to treatment. That is also correct. So wrong wala statement was asked, and wrong wala statement is option number B. I hope that is okay with everyone. Now all these 4 leukemias we have done a quick recap of, and I hope it's been useful for you guys. तो एक basic overview हो गया. ALL, AML, CLL, CML. Now what? Obviously, ma'am, now we are going to make life a little more tougher. So first, I'm obviously going to teach you. I'm going to teach you these 2-3 summary tables, okay? After teaching you, then I'll obviously bombard you with questions, and then you're going to give me all right answers also. Okay, having said that, Dr. Amit says, ma'am, why blasts are less in chronic? देखो, उल्टा question है. Blasts are not less in chronic. The blasts are less. That is why I'm calling it chronic. When the patient can respond in 2 ways, na, either the blast count is going to be very high, and that is going to be worse for the patient, more proliferation. That is why I called it acute. And when the blast count is very low, that is going to be less proliferation for the patient. That is when I'm going to call it chronic. So acute and chronic is the presentation. It's not on the reason why the blast count is less. The blast is less, and that is why I've called it acute or chronic. It's the other way around, okay? Chalo, having said that, now we are going to come down to the next one. The next thing is, ma'am, we are starting with lymphomas, and we are starting with everyone's favorite, Hodgkins lymphoma, okay? So now what I'm going to do, I'm going to take 5 minutes of your life, and I'm going to make a full table, just one slide, one table for entire Hodgkins I'm going to make for all of you, okay? After that, you will start practicing some 4-5 questions for me from Hodgkins lymphoma. Deal? So if I teach you well, matlab I take it on myself. If I will teach well, you will answer well, okay? So now you have to make me believe that I teach well by answering the questions. So you have to listen to that. Hodgkins lymphoma is of 2 two types. Hodgkin's lymphoma is of two types, that is classical Hodgkin's lymphoma and non-classical Hodgkin's lymphoma. Why did we divide it as classical and non-classical? Because ma'am, again microbiology, which virus causes it? Ma'am, the ones that were associated with Epstein-Barr virus, they have been put under the classical variety. The ones which are not associated with Epstein-Barr virus, that has been put under non-classical. That is why you divided it as classical and non-classical, whether EBV is there or EBV is not there. Okay, one point is done. Now let's do the names. Which are the ones which are EBV positive, means which are the ones. So I realize everything is coming under this only. Everything is coming under the classical variety. What all? Nodular sclerosis. Nodular sclerosis is the most common Hodgkin's you find all over the world. Next one is MI, mixed cellularity. Why did I say MI? MI matlab MI. M for most common, I for India. This is the most common Hodgkin's in India. So remember, nodular sclerosis for the world, mixed cellularity, MI is going to be for India. Then ma'am, two more. There is going to be something known as lymphocyte rich, when there are too many lymphocytes. And the other is lymphocyte depleted, when then there are no lymphocytes. Easy to learn na? Ya to too many lymphocytes, ya fir no lymphocytes. So what are the four classical varieties? Number one, in the world you have nodular sclerosis. In India you have mixed cellularity, too many lymphocytes or too little lymphocytes. Ye चार types हो गए. What comes in the non-classical one? The non-classical one means there is no association with Epstein-Barr virus, NLPHL. एक ही आता है. What is this? What did I just say? NLPHL means nodular lymphocyte predominant Hodgkin's lymphoma. NLPHL, nodular lymphocyte predominant Hodgkin's lymphoma, the only non-classical one. Names we have learned. Now I'm going to tell you the last part. Ma'am, what are the RS cells that you see? In classical Hodgkin's lymphoma, the markers for the RS cells are what? 15, 15 ka double, 30 and PAX5. So all these four that I'm talking about over here, they are going to be CD15, CD30 and PAX5 positive. But what cells are they? Someone said that, ma'am, can you tell us? Try filling it up. Tell me the names of these. Which are the ones which are 15, 30 and PAX5 positive? So see, in nodular, you see lacunar cells. Rhyming ho gaya na? Which kind of Reed-Sternberg cells do you see? In nodular sclerosis, you see lacunar cells. Point number one. In mixed cellularity, ma'am, mixed cellularity mein you see the classical one. Like India mein classical dikhega. What is the India wala classical? The classical owl eye appearance. I'll be showing you pictures in a while. The classical owl eye appearance is what you're gonna see. Fine. Then, ma'am, lymphocyte rich. What do you see in the lymphocyte rich variety? Which kind of RS cell? So I have learned mononuclear. Mononuclear matlab one nucleus. How do I learn this? One nucleus wala. See, this is just a life lesson that I'm telling you. If you keep running after money in life, if that is the only priority that you have in life, that is lymphocyte rich. So this lymphoma only, to become rich, it only kept running after money. That is why it was forever single. It has been left alone in the end. It has become mono. It has become very alone and single because it only gave priority to money all its life. Okay? So if running after money, left alone. That is how you learn that lymphocyte rich is going to show you the mononuclear RS cells. And lymphocyte depleted, ma'am, depleted word only sounds so dead. So there is going to be some dead kind of an RS cell. That dead kind of an RS cell is what? That is a dead wala RS cell, mummified RS cell. Okay, so now the RS cells are done. Let's do a recap. Nodular shows you which RS cells? Lacunar. Okay, mixed cellularity, India wala, owl eye appearance, classical. Lymphocyte rich, ma'am, rich and alone. So that is going to be mononuclear RS cell. And lymphocyte depleted, depleted means dead. So that is going to be mummified. And all of them are positive for, repeating once again, all of them are positive for which markers? They are positive for 15, 30 and PAX5. What was the question that came in the last session? Which of these is the sensitive marker? That is CD30. And which of them is the most specific marker? Which of them is the most specific marker? That is PAX5. In fact, this is the expected question this time also. What is the specific marker for all these, any Reed-Sternberg cell mentioned? Nodular, auli, mononuclear, mummified. Sabke liye this is going to be the same. That is PAX5. That is the most specific marker that you have. But all of this was only to do with the classical variety. Now we have to go ahead and talk about the other one, the non-classical variety, because in the non-classical variety, the markers have changed. Now you've come into 20s and doubles wala series, 20, 45, EMA. What are the markers? 20, 45 and EMA. These are the markers that you have for non-classical. And the RS cell that you see over here is popcorn. That is, ma'am, an RS cell you will show me where there will be aisa popcorn. I'll show you these pictures. Popcorn wala RS cell that has been kept separate. That is what you see in NLPHL. Now tell me one thing, which is the most tasty word out of these? Ma'am, jo sabse tasty word tha, that was what? That was popcorn. So if someone asks you which is the best prognosis, ma'am, popcorn wala RS cell, this non-classical popcorn RS cell, that is going to have the best prognosis because popcorn is our favorite word out of all of these. And which is the most mara hua dead kind of word out of all of these? The most mara hua dead kind of that is lymphocyte depleted. So ma'am, that automatically becomes the worst prognosis. Easy to learn. Tastiest is popcorn, so that has the best prognosis. Mara hua, mummified and dead is the worst, so that is going to have the worst prognosis. Everyone started discussing type of popcorn, so abhi nahi, abhi you movies and popcorns are a little away for you, 10 more days to go. So yes, after that you can enjoy all movies and popcorn, but abhi focus. Okay, so now there's a twist in a question that came in medicine. First year they asked you which is the best prognosis. The best prognosis, ma'am, popcorn wala we marked. But popcorn was non-classical variety. So next time they ended up asking you which is the Hodgkins lymphoma in the classical variety, which is the best. Twist in the story. So classical may remember it is nodular sclerosis. So ultimately I realize that dono nodular things are good. Classical maybe nodular wala is good, non-classical maybe nodular wala is gonna be good. Okay, so dono jo nodular ones are there, they are really good out here. Okay, so now if overall it is asked, overall popcorn will be the best. But if they ask you particularly in the classical variety, then the nodular sclerosis is gonna be the best. This is your final table for Hodgkin's lymphoma. This is your final table. Remember, popcorn being the best is what is expected. Okay, if you've been listening to me very carefully, I think you can quickly answer 4 questions for me. Tell me guys, which is the most specific marker for a Reed-Sternberg cell, so that I can show you some pictures. The most specific marker for the Reed-Sternberg cell. We had 3 markers, CD15, CD30 and PAX5. So इसमें से जो specific अभी I had highlighted so well that PAX5. Okay, so as I told you that yes, you have given me correct answers, means you were listening carefully. PAX5 is the most specific marker. Amazing. One more question, छोटा वाला question. Okay, which of the following markers are positive in NLPHL? Nodular lymphocyte predominant Hodgkin's lymphoma, also known as non-classical Hodgkin's lymphoma. Ma'am, ये हमारा favorite type of question है. Whenever I see something like all of the above written, it is going to be our favorite question because my mind will tempt me towards mark all of the above. Yes, correct. 20, 45 and EMA, all of them are non-classical. ये तो confidence booster वाला question था. Coming to another confidence booster, easy one. Lacunar cells are seen in. Lacunar cells are going to be seen in which kind of Hodgkin's lymphoma? Go by the rhyming wala word. Ma'am, lacunar was rhyming with okay, yes, lacunar was rhyming with nodular. Perfect. So I've started getting answers. Option A, lacunar is seen with nodular. Now that you've answered all of this, let me show you some pictures so that that entire process is completed, and then I'll give you one lengthy question to solve. Okay? So these are the 3 photos of RS cells that you can possibly get in the paper. The first one is the classical owl eye appearance. I don't think I need to describe this. It's staring towards you, these 2 eyes. It's showing very well. So matlab, ma'am, this must be a case of India wala. Classical India wala, that is going to be classical mixed cellularity. Okay, coming to the second one. How do I identify a lacunar RS cell? Let me zoom in. you will realize that this RS cell, this must be the RS cell. Can everyone see a white area around it? Lacuna, kuch lacuna hai ma'am, there is some lacuna around it, a whitish area around it. So if I'm seeing a lacunar RS cell, the disease that I'm going to think of will be which Hodgkin's lymphoma? Nodular sclerosis. Okay, having said that, now coming to the last one, easiest to identify matlab, and that is, ma'am, it's looking just like a popcorn. Easiest, tastiest cell, popcorn RS cell. Which disease are you thinking of? NLPHL. Prognostically, popcorn very tasty. Prognostically, it's got the best prognosis. Okay, so all these images are also done. Ab you are ready with images, you are ready with one-liners. I also have to make you ready with little lengthy wala questions. Now read very carefully, put all your common sense into it and then answer, guys. Okay, you know all of it, just apply the knowledge very well. What would you give me as this for your answer? A 40-year-old patient, cervical lymph node, inguinal lymph node, there is cough, there is weight loss since the past 4 months. Excision biopsy shows large cells with mirror image nuclei in a background of eosinophils and plasma cells. The large cells are positive for CD15 and CD30. Which of the following is the most likely diagnosis? Okay, so I am very happy with everyone giving me right answers even with a lengthy question. Dekho, isme first thing was that there is an RS cell positive for 15 and 30. Ma'am, this means we are talking about some classical Hodgkin's lymphoma. If I'm talking about classical Hodgkin's lymphoma, option 4 to rule out ho gaya because that is non-classical. I can only select between A, B and C. In that, I realized if I look at their words, if examiner would have written there are only and only lymphocytes seen, I would have marked lymphocyte rich. If examiner would have written there are lots and lots of nodules seen, I would have marked nodular sclerosis. Examiner has written lots of cells. Examiner ne kaha hai there are cells with mirror image nuclei. Mirror image nuclei means, ma'am, the 2 eyes. And examiner has said there is all mixture of cells. There are plasma cells also, there are eosinophils also. Ma'am, all mixture is mentioned. So that is why I will take it up as mixed cellularity. And what is this mirror image nuclei? Matlab which RS cell? Mirror image nuclei means the 2 eyes, the mirror image nuclei. Ma'am, owl eye was mentioned. If owl eye was mentioned, then also my mind will take me towards mixed cellularity. So there were 2 hints. The owl eye was mentioned and mixture of cells was also mentioned. So yes, this is a classical case of mixed cellularity. So you are confident with lengthy questions also. So ma'am, Hodgkin's mein our one-liner will come or a lengthy will come or an image will come. We are probably prepared for everything. So what are we left with? Now if you feel life is going very smooth, let me make it a little difficult by telling you that next you are going to study with me non-Hodgkin's lymphoma. A real deal comes over here. There are going to be lots of numbers, chromosomes, CD markers. Matlab life is going to become a little tough over here. Don't run away. It's all about patience. You will have to give me a little bit of time, 5-7 minutes, and then life will be back to being good again. Okay, so you need to know why is this topic considered tough, non-Hodgkin's lymphoma, because there are 7 types of B non-Hodgkin's lymphoma, 2 types of T non-Hodgkin's lymphoma. Some number game wala mnemonics I will give you, some fancy stories I will give you. At the end of it, we will be able to learn it. There is no doubt about it. Okay? So thoda confidence rakho, we will crack this. What am I going to do? I have written some chromosome wale numbers over here. I'm not going to teach you how it's written in the textbook page by page and wasting 10-20 pages of your copy. We are going to study it in 4 slides. Bas 4 slides mein all the NHLs we have to finish off. It's a deal that we are doing. So remember, when I'm talking about 8, 11, 14, 18, what is that? Ma'am, as soon as chromosome number 8 will be written, 8 looks like a B. 8 is going to look like a B, right? So ma'am, whenever examiner gives me translocation 8 and an even number, 8 and even number, matlab, let me give you some examples. Examiner has written 8 and 14. Or examiner has written 8 and 22, or examiner has written 2 and 8. Matlab 8 with any even number. Ma'am, 8 looks like a B, so we are dealing with Burkitt's lymphoma. We are dealing with Burkitt's lymphoma. I hope that is simple for everyone. Yes, 8 ho gaya, B ho gaya. I am talking about Burkitt's. Now, over here, I'm going to also finish off how Burkitt's is going to look like. What am I going to get in Burkitt's? Classical case of when this poor African child has become such a celebrity because every exam gives only his picture. So there's always going to be an African child, and you can see the very famous jaw swelling that we have over here. Okay? There's an African child with the jaw swelling. What is the significance of giving an African child? Because Africa mein Epstein-Barr virus occurs, and that is how you will give the diagnosis of Burkitt's lymphoma. Burkitt's happens because of EBV. EBV is endemic in Africa and it occurs in the jaw. That is why this child is so famous. African child with jaw swelling. And what are you going to see under the microscope? This so you can answer even in your sleep by now. It's such a famous question. That is what? That is going to be the famous starry sky appearance. What do we have in starry sky appearance? Ma'am, there is going to be a sky. Sky matlab there is something in the background, something dark that you have in the background. What is that sky? That sky is the dark blue color. That entire place is all blue, na? This entire slide is all blue. That is the sky. That is the cancer. That is the Burkitt's lymphoma. And in between you are having few stars. You have few shining stars in between. What are these white areas? Ma'am, these shining stars are nothing but macrophages. So fault is where? So for this mnemonic, fault is not in the stars. Fault is not in the stars. The fault is in the sky. The cancer wala part is the sky. Okay, the fault is not in the stars. Stars are nothing but macrophages, simple cells. The cancer is the sky wala part. That is about Burkitt's that you're going to get in the paper. One more thing, did you notice this was an African child? They never tell you some 40-50-year-old person. They will always tell you some 10-11-year-old wala child, because Burkitt's is very commonly seen in kids. And why did I tell you that Burkitt's is seen in kids? Because kids say, you will remember KI for kids, and remember Ki67 is 100%. There is a marker for Burkitt's, that is Ki67, that is 100%. So how will you learn it? Ki will remind you of kids. So Ki67, kids wale lymphoma mein it's gonna be positive. It is going to be 100%. Full story about Burkitt's is okay because it's the most expected. Quickly reminding you, all the translocations are gonna be something related with 8, and 8 ke saath there is gonna be an even number. That is the trick over here. You'll get an African child because African child will tell you Epstein-Barr virus. Child and kids will tell you that Ki67 is 100%, and we see the very famous starry sky appearance. Coming back to the other numbers, guys, we have 11, 14 and 18 mentioned. So now this is the story of teenagers. If I put the teenagers together, chromosome number 14 and chromosome number 18, teenagers best friends, ma'am. Teenagers best friends. Friendly lymphoma, follicular lymphoma. That basically means that, why did I call it friendly follicular? Because follicular lymphoma has the best prognosis. Follicular lymphoma is friendly. Friendly matlab good lymphoma, good for the body. Treatment is simple. So follicular, friendly, friendly mein teenagers. The teenagers are 14 and 18. So teenagers are sorted, friendly mein. After that I say, now pick up a teenager and his younger brother, and everyone in the house will go mad. That is mental hone wale hain ma'am sab. Mantle cell lymphoma. Mantle cell lymphoma is what? It's translocation 11 and 14, means teenager with a younger brother. Everyone has gone mad in the house. Everyone has gone mental in the house. That is mantle cell lymphoma. And remember, mantle cell lymphoma is cyclin D1 positive. And they will ask you a question. Mantle cell lymphoma is cyclin D positive, E positive, A positive. बहुत सारे numbers, alphabets लिखा होगा. Cyclin A, B, C, D. तो remember, ma'am, mental, everything is mental, na? You had put a teenager with a younger bachcha. So 11, 14, everyone going mental and dumb. Everyone going mental and dumb. So remember, mental, dumb. So cyclin D1 is going to be the one that is going to be positive, not cyclin ABC. Cyclin D1, dumb wala mental hoga. Finally, ma'am, pick up the numbers left. Kya combination bacha? I am left with the margins. 11 and 18 ka combination is left. One is just entering into the puberty, one is getting out of teenage, 11 and 18, margins. When I pick up 11 and 18, that is marginal zone lymphoma. That is going to be marginal zone lymphoma. So as simple as that, now the translocations are done. All your translocations are done. So you can now quickly tell me, if I randomly ask you, let me randomly ask you, where would you see translocation 8 and 22? What do you want to answer? Translocation 8 and 22? Ma'am, 8 hai, even number hai. This means you are dealing with the B wala. You are dealing with the Burkitt's lymphoma. Easy. If I say, tell me what is translocation 14 and 18? Teenagers, 14, 18. Teenagers साथ में है मैम friendly वाला lymphoma. Friendly means follicular. If I say there is 11 and 14, 14 with a younger brother, everyone going mad in the house, that is mantle cell lymphoma. And mantle basically means that cyclin D1 is going to be positive. Then if I pick up margins of age, 11-year-old and then adult, 18-year-old, 11 and 18, ma'am, that is going to be marginal zone lymphoma, totally other end, marginal zone. So now tell me, are the translocations any difficult? I don't think so. They seem to be pretty simple. Abhi the last part. Ma'am, we will also be asked about the markers. So tell me one thing, what is Ki-67? I just told you, Ki-67 coming as 100%. Which lymphoma will you think of? Ma'am, kids wala lymphoma. Kids wala lymphoma we have studied is the Burkitt's lymphoma. So this part we already know. Okay. Coming to the next one. First tell me, annexin A1 kiska marker hai? Ma'am, annexin A1 is the next lymphoma that is known as hairy cell leukemia. I'll be talking about hairy cell leukemia right now. Hairy has A1 in it. See, look carefully. Hairy has AI in it. So remember A1. Annexin A1 is the marker for hairy cell leukemia. Coming to the other markers, CD5 and 23. दोनों को हमेशा साथ में. You always have to take them together, okay? Either both 5 and 23 will be positive, or both 5 and 23 will be negative, or only 5 will be positive. There are only 3 situations possible. Where did I teach you half an hour back? Both of them coming positive. Sab kuch positive. Ma'am, that was seen in CLL, SLL. CLL, SLL, sab kuch positive. Okay? Everything negative. Ma'am, margin. Margin to, if I look at a photo, you will always ignore the margins. Na margins ko ignore karo. So marginal zone is going to be everything negative. And what am I left with? Mantle cell lymphoma. Mantle is only going to be 5 positive. So let's do a repeat. CLL, SLL is going to be sab kuch positive. Okay. Marginal zone, ignore the margins. Everything is going to be negative, whereas mantle cell is only and only 5 positive. That also finishes off all your markers. Actually, now you will realize that there is actually just 2 or 3 more words left, and after that your lymphomas are done. Because follicular ke liye someone asked me, Dr. Dharamveer, follicular is actually 1920 BCL2 positive, but that is too advanced and information and not important for the FMG exam, so you can definitely skip that for FMG. For NEET, yeah, 1920 BCL2 positive for follicular. Okay, having said that, now coming to, ma'am, this hairy cell leukemia is very, very important, and they give me a lot of questions on it. Hairy cell leukemia, you will be studying it with me with the help of a story, and that is the story. You are all Gen Z people, you are all the ones who are too much into social media, so this will be one of your best stories which you will relate to a lot. And on social media, there is this boy who's desperately wanting to be viral. Viral hone ke liye, what is he doing? You must have seen those really shady kind of videos that you see for people who are desperately wanting to be viral. What do? They usually get some really bad red hair color. So that is one thing. For odd reason, they have these red, golden, brown kind of hair. Second, they have to make gym videos because gym videos will always get you more views. They always keep talking about eggs and proteins because that is again going to get you good views. And they are always going to use some Apple product or Mac product because of course show off bhi zaruri hai, right? So this is a person who is desperately wanting to be viral, and that is what is hairy cell leukemia. I'll tell you how. So when I talk about hairy cell leukemia, tell me one thing, this boy who's got his red color hair and who's going to the gym only focusing on eggs, showing off about Mac, is he going to be good in studies? Obviously not, ma'am. You know, good hone ke liye, then he should have been sitting at 6 o'clock, 7 o'clock in the evening listening to YouTube sessions and studying with all of us rather than putting red hair and gym videos, right? So he's not at all not at all an intelligent person. He's a brat boy. He's a brat boy. So what is that? BRAF mutation. So hairy cell leukemia is going to show you BRAF mutation. Kal bhi padha tha. We had studied BRAF yesterday also, right? So number one, the mutation that you see in hairy cell leukemia, ma'am, he's a brat boy. Why am I calling him a boy again and again? Because boys are more hairy. The hairy cell leukemia is more commonly seen in boys. Boys are more hairy, so this is more commonly seen in boys, and it's a bigda hua brat boy. That is how I learn it. What is the marker? I just told you hairy has AI, so what is the marker going to be? The marker is going to be A1. Okay, next. If I ask you, what is the infection? Which infection will this kid suffer from? MAC infections. What is MAC? Microbiology, Mycobacterium avium complex. That is what I told you, na? He's going to suffer from MAC infection. So from MAC, you will know that this is going to be MAC infections. Okay, what is clinical presentation going to be? Splenomegaly. Ma'am, which part of the spleen is enlarged? Whenever the color is asked in hairy cell leukemia, you have to give the color as red, because the red-haired boy will come to your mind who's trying to be viral. So which pulp of the spleen is going to be enlarged? The pulp of the spleen is going to be the red pulp. Okay, ma'am, he's always talking about gym and eggs. So bone marrow biopsy shows you a fried egg appearance. I want you to focus on something. Bone marrow biopsy shows you a fried egg appearance, not a bone marrow aspirate. Bone marrow aspirate shows you nothing. Dry tap. Bone marrow aspirate matlab you put a needle, you got nothing out of it. Bone marrow aspirate is not going to show you anything. Bone marrow biopsy shows you a fried egg appearance. And finally, these cells are TRAP positive. TRAP gives what color? Whenever I will ask you color in hairy cell leukemia, which color will you tell me? Ma'am, the color will always be red. If you ask me the color of the spleen, red pulp. If you ask me the color with TRAP, red color, because red-haired boy will come to my mind. So always remember, we are talking about a red-haired boy trying to be viral. So red will remind you of red color with TRAP, red color of the spleen. The eggs will remind you of fried egg appearance. His MAC book and his show-off will remind you of MAC infection. Hairy, boys are more hairy, so this is seen more commonly in boys. And this is a bigda hua brat boy, so you're gonna see that is BRAF mutation. I hope that is okay. Now there's one question which everyone has been asking me again and again, that ma'am, how will we get to know what is B cell NHL and what is T cell NHL? So having said that, everything that I have taught you up till now, everything was B cell. I have not gone into the T cell variety. So now I told you that there were a total of 7 B NHLs. There were a total of 7 B NHLs. I have taught you everything: follicular, Burkitt's, mantle, marginal, hairy cell. Abhi tak I have not gone into the T cell zone only. So simple to learn. Abhi tak, ma'am, whatever we studied was coming under B NHLs. Because now I will tell you 2 NHLs which are T NHLs, and those are the only 2 T's that you have to learn. Otherwise, baki sab is gonna be B NHL. Now is that gonna be okay? Yes. So what are the 2 T NHLs that you have to know, which is going to solve your entire story? And that is mycosis fungoides. Very good, I've got answers. And anaplastic lymphoma. Simple. So now the life becomes easy, that ma'am, whatever you had mentioned was B NHL. Whether you write mantle cell, marginal zone, Burkitt's, follicular, hairy cell, kuch bhi ho, B NHL. Whereas for T NHL, you have 2 things. One is mycosis fungoides and one is anaplastic lymphoma. Okay. Ab dono ke liye, I'm going to tell you one buzzword. To identify them in the exam, you have to know one very important word. So dekho, why did you call it mycosis fungoides? Why did we label it as mycosis fungoides? Mycosis, ma'am, and fungus. It's sounding something like mycology. It's sounding something like a fungal infection. Is it a fungal infection? No. It looks like a fungal infection because people come to you with skin lesions. Patients come to you with cutaneous lesions. It is a cutaneous NHL. It is a cutaneous NHL. So please remember, what is it? This is a question that comes, which is the only lymphoma which has skin rash, cutaneous manifestations. That is going to be a cutaneous TNHL. Having said that, this shows you presence of Pottrier's microabscess. There's a question, very famous question that you get in dermat. I'm deviating a little bit away from the topic, but ये कहीं ना कहीं बाद में काम आएगा, so listen to me carefully. It's about dermat, okay? There are two abscesses. There is something known as Pottrier's microabscess in dermatology that you get, and the second one is what? Very good, Munro's microabscess. This is a very common source of confusion, that ma'am, which skin disease shows you which abscess? Remember PMMP. That is how we learn. PMMP means if you've got a P written over here, then the disease has to be an M. अगर P लिखा है तो disease has to be M. If M is written over here, this means that the disease has to be a P. So remember, PM combination you will have to do. So if P is written over here, Pottrier's microabscess, the disease has to be with M, and that is mycosis fungoides. That is mycosis fungoides. And if M is written over here, Munro's is written, then the disease has to be with P, and that is psoriasis. Exactly. So simple way to learn that, ma'am, there has to always be a combination of PM. So Pottrier's पूछा, so that is seen in mycosis fungoides. Munro's पूछा, so that is seen in psoriasis. Or you can learn, keep the two P's away, keep the two M's away, your wish. PM mnemonic, you have to put it up. Okay. Having said that, now cutaneous wala you have understood, Pottrier's microabscess, mycosis fungoides. The last one is anaplastic. Two things. There are two cells that you see in anaplastic lymphoma. That's the last ratta that you have to do, and then you're going to solve questions. Anaplastic lymphoma shows you a cell which looks like this. What is this? This is a classical, ma'am, tasty words coming today. Pehle popcorn padha tha, ab donut padenge. So what is this? This is a round wala proper donut cell. So number one, anaplastic shows you donut cells. Number two, this is a theory question that you get. It shows you hallmark cells. I've got you a picture. Ye wala photo dekho. Can you see these two cells which are looking like a kidney? These two cells which are looking like a kidney. Yes. So you will say, ma'am, so many things look like a kidney in pathology. How will I look at this and just guess in the word that this they are talking about? ऐसा नहीं होगा. No one is going to give this to you like a spotter. This word will always be written. Hallmark has to be written. They're never going to leave you in the, in the dark like this with this picture and say, ab identify karo. Nahi. Even if they give you this picture, they will write, hallmark cells are seen. So this picture is useless after that. Ma'am, this word will always be written. Hallmark cells are seen, donut cells are seen. I will be able to identify that it is a anaplastic. So now coming back, since all of you were worried, there are only two TNHLs. One is an anaplastic lymphoma, which is TNHL, and the other is mycosis fungoides, which is TNHL. दोनों का एक word है. Mycosis fungoides shows you which abscess? It shows you the Pottrier's microabscess, and anaplastic shows you which cell? Ma'am, एक वो donut वाला cell and एक वो hallmark वाला cell. So that is simple. Now, is it actually simple or not? And that you will get to know when you start solving a few questions. Let's see if we are able to get this right. A starry sky appearance in the histological slide is due to. Yes, the starry sky appearance in the histological slide. So think logically. Starry sky appearance, ma'am, I know which lymphoma is it. I'm very, very confident. Starry sky appearance is said to be Burkitt's lymphoma. And for Burkitt's lymphoma, the translocation that you told me was ke 8 ke saath you have to put up an even number. So the one that I can see over here, 8 an even number. Perfect, that is the answer. This could have been anything. It could have been 8 and 14, it could have been 8 and 22, it could have been 8 with any even number on this planet. I'm not bothered what the other number is, as long as it's an even number, and 8 hoga saath mein. So 2 and 8 an even number. Okay, let's move on to the next question, which also came in your previous year papers. A lymphoma which presents with cutaneous manifestations, which is the only lymphoma which I told you having, right, which is going to have cutaneous skin. It's going to look something like a fungal infection. Very simple question, ma'am. Aisa question aaye to we'll be so happy with it. And that is mycosis fungoides. And which abscess are we talking about? The abscess in mycosis fungoides is known as the Pottrier's microabscess. Perfect. It is going to be the Pottrier's microabscess. Amazing. Okay, moving on to lengthy question. We have two lengthy questions coming up your way, so be very cautious with whatever you're gonna answer now. Okay, so let's start reading. You have an elderly patient with fatigue. There is massive splenomegaly, lymphadenopathy. Hemoglobin is 8, TLC 1600, platelet count is 49,000. There is cells which are showing positivity for annexin A1, and such a nice examiner. He's told us diagnosis of hairy cell leukemia. All of the following are true except. What is your answer to that? Okay, there are majority, I always go with majority. The majority of you have told me कि ma'am D hai. Some of you have also told me B as the answer. So see guys, when I look at it, I realized I had a patient who had massive splenomegaly and they have told me it's a case of hairy cell leukemia. Can you tell me which part of the spleen must have been affected for hairy cell leukemia? I told you that red-haired boy na. So ma'am, the part of the spleen that would have been affected is the red pulp. So this means this is true. This is totally true statement. Then did I tell you that red-haired boy is going to do a lot of show off with his MAC products? So he's going to have which kind of infections? He's going to have Mycobacterium avium complex, atypical mycobacterial infections, Mycobacterium avium complex, वो भी true है. Did I say that boy is a brat, बिगड़ा हुआ brat boy, he's not gonna study, so is he gonna show you BRAF mutations? Yes, that is also true. Does it show you fried egg appearance? That is true, but does it show you fried egg appearance on a bone marrow aspirate? That was the catch over here, na? I told you again and again, bone marrow aspirate is a dry tap. Bone marrow biopsy. Bone marrow biopsy is going to show you the fried egg appearance. So they asked you which of the following are true except, matlab false wala statement you had to pick up, and that is the answer that you have over here. So option D is the correct answer that you got to know. And most of you were right, so which is very good. Ek aur lengthy wala question kare. Let's go ahead, do one more lengthy question, which is the last question that we have for the lymphomas. You have a 45-year-old man with right axillary and left inguinal lymphadenopathy. Chest X-ray has a 4 centimeter nodular pleural mass. There's a retroperitoneal mass also. And the inguinal lymph node shows you hallmark cells. Once you read that line, you should know your answer. The cells are positive for T markers, and what is the likely diagnosis? So what is the buzzword? See, now I told you, if you were listening to me carefully and if you were listening to every of those one buzzword, then that basically means that hallmark cell pad liya ma'am. Hallmark cell reminded me of anaplastic lymphoma. But ma'am, in the exam I was a little doubtful. Can I actually solve answers by looking at one word? So now I know anaplastic lymphoma shows me hallmark cells. I also know that anaplastic lymphoma is which NHL? B NHL or T NHL? It's a T NHL. So did the examiner tell me about the T variety? Yes, these cells are positive for T cell markers. T cell markers are positive in it. So I'm on the right track, means I have put up a right question, that is anaplastic lymphoma is the right answer. So can I basically say that we are sorted finally? We are sorted with this and the lymphomas and leukemias are done. So now when I'll be sharing the PDF over Telegram, at least you guys will be able to rush through these main points. You will realize Hodgkins lymphoma is 1 slide, non-Hodgkins lymphoma is 4 slides. So basically in 5 slides your entire chapter to do with lymphomas, Hodgkin, non-Hodgkin, वो सब खत्म हो जाएगा. Obviously it's been a lengthy session, so you guys must have been a little tired, but obviously I'm not ending the session right now because there is one more thing that I had promised to all of you, which all of you are going to answer. But yeah, after this we will wrap up. तो बताओ, tell you this is something that we are going to talk about. You have to tell me the match the following. So either you can tell me one by one or you can select from here. Yes guys, so what is this? And obviously this is not the only and the last session. There are going to be more sessions also, but few things at a time. One by one we will proceed in the entire course. Most of you, I mean, what a smooth answer, ma'am. This not only solves one question, but actually solves 4 questions for me. I'll come back to this. Let me show you. Basically, I want to show you all the spotters that you're going to get in kidney. Kidney mein na set questions hai. Kidney has reached its saturation. Means either the examiner is going to give me this question or no question. There's no new question that can come in the paper. So first, the examiner will have to give me all the gross appearances of the kidney. Second, examiner is going to ask me about the cast and the crystals. ठीक है, ये this is only that And I love these match the following questions, because even if you knew one option, na, you could have easily answered it. You don't have to know all the 4 options honestly to answer a match the following. Ek do bhi aata hai to chalega kaam, right? So let's go one by one. Then I'll come back to this question also. So remember, the first one is putty kidney. This was a previous year NEET question, much expected this time in FMG. Putty kidney. What is putty kidney, ma'am? I can see the kidney over here, and it's got that white cheese wala material. What is that white cheese material? That is referred to as the caseous necrosis. That is referred to as caseous necrosis, means I am talking about tuberculosis. But the question that actually came in the NEET exam was isi ka corresponding radiology. You can see the same cheesiness and the same kind of concretions that radiology is forming. So putty kidney is going to come across as a caseous necrosis, either pathology or radiology. You should know putty kidney is to do with TB. Number 1. Number 2, there's a very famous waxy kidney. Waxy, not just see, waxy matlab like candle wax. I can see that. Waxy means candle wax, and that is going to be the waxy kidney, right? Where do I see it? That is seen in a case of amyloidosis. That is seen in the case of amyloidosis. So now the good news is, amyloid pe question, whenever it comes, it's going to be waxy. Whether they say kidney, so waxy kidney. If they say amyloidosis spleen, waxy liver, waxy heart, anywhere amyloid is going and that area is going to become waxy. That is how I learn it. So quickly tell me something from general path. What is the best stain for staining amyloid? This question you know, it's a confidence booster for you. What is the stain for amyloid that you got to know, guys? This is the very famous Congo red stain. I don't even have to wait for answers. I am confident that you guys know. Congo red pe kya color milta hai? Congo red stain, ma'am, gives us the very famous apple green birefringence. Yaad aa raha hai kuch general path? I'm sure you know this. It shows you the apple green birefringence, and that is what you see on which microscopy? You see it on polarizing microscopy. Every word that I have written over here is important. You see it on a polarizing microscope. So repeating once again, there is what? Ma'am, amyloid ka best stain is Congo red. Question number 1. Congo red gives what color? It gives an apple green birefringence. Question number 2. Which microscopy will I use for that? I will use polarizing microscope. Now they give you amyloid of any organ. Amyloid spleen, liver, kidney, any organ, my answers are the same. Same Congo red, same apple green, same polarizing microscope, same waxiness. Okay, coming to the last 2, that is the 2 alag kidneys. The first one, ma'am, is a kidney which has become very granular. Means this is the kidney, and that kidney is looking as if there are some dot present. It's a very granular kind of a kidney. That is what you see in a case of benign hypertension. When there is benign hypertension, we see granular kidney. Whereas look at the next one, the flea-bitten kidney. What is that? Flea-bitten. Flea means what? It's an insect. See, when an insect bites you, that area becomes red, na? So this is like a kidney, as if, you know, flea has bitten it. Some insect has bitten it. So the entire kidney is going to show me these red color spots. These red color spots, if you look carefully, the entire kidney is going to show me. That is what you see in a case of malignant hypertension. Very good. That is what we see with malignant hypertension. So simple. If there's benign hypertension, we'll see granular kidney. If there's malignant hypertension, malignant word only being why redness? Because red is a little bit of a malignant color, right? So redness, red dot wala, that is gonna be the malignant hypertension. So simple. Now my question is so easy, guys. Let's do a recap. Putty kidney. Putty kidney we had studied for caseous necrosis, and that is TB. That is sorted. Then we have waxy kidney. Waxy kidney, ma'am, we have studied was for amyloidosis. Coming to the next, leather grain kidney. Granular kidney is something that we see in benign hypertension, and flea-bitten kidney we see in a case of malignant hypertension. So I hope now option 2, and that is what I said, even if you knew 1 or 2, you could have got the answer right. That is why I always want match the following kind of questions should come, because you don't have to know each and every option. You can do a little bit of guesswork also out there. Okay, this was one set of spotters that you had to know. Let me ask you the next one. I know all of you know this. It's very simple. Don't make any error out of it. You have to identify this crystal that you're seeing. You have to identify this crystal. Is it cholesterol, cysteine, calcium or triple phosphate? Very good. So yes, तो अब दो चीज़ें रह गई. What are we left for today? We have to look at the pictures of the crystals and the casts. Answer is in front of you, okay. But tell me, where am I seeing these crystals and casts? What sample have I got from the patient? So crystals and casts are seen in a urine sample. So I am going to do a urine microscopic examination. I'm going to do a urine microscopic examination, and that I will see all these findings. So there's one, I'll show you this. Then we'll zoom into each one of these. These are all the different crystals that you have to know. These are all the different crystals, and you get spotter. See, there are 2-3 things जो आएगा exam में. Crystal पे question will come. Crystals, casts, one question is mandatory, and same way like in microbiology you have all those andas, the parasitology, eggs. So there are some questions which will pakka come. I mean, we can, if it's a proper balanced paper that the examiner makes, he will have to give you these questions, okay. So crystals and casts ka one question is fixed. Similarly in parasitology, andas ka eggs wala question is gonna be fixed, okay. Having said that, let's begin. So how do I identify? Let's zoom into each one of them. So the first one that I have, ma'am, this is a crystal which I can see 1, 2, 3, 4, 5, 6. जो 6 sides वाला crystal है, that is going to be the cysteine crystal. So remember, cis and 6. Cysteine crystal is going to look like a 6 wala side. Simple. Okay. The next one that I have over here is a tyrosine crystal. Why do I call it tyrosine? Because now look at this, tyrosine is going to be very, very thin. So look at these crystals and you will say, ma'am, look at the patla lines. Look at how thin they are. They are such thin bundles of needles. Yes, so tyrosine is going to be very, very thin needles. Easy to learn. So till now we were only doing mnemonics. Now we are doing picmonics. Picture में से mnemonic we will have to take out to identify in the exam, right? So remember, cysteine is going to be 6 and tyrosine is going to be thin. Coming to the next, ma'am, now comes the story of the 2 calcium oxalates. There are 2 calcium oxalates that we have. One is calcium oxalate dihydrate, one is calcium oxalate monohydrate, and I think everyone remembers the famous mnemonic, that is Mona is dumb. Mona is dumb, ये सबका favorite most mnemonic होता है, and that is what we are coming to. See, when I say Mona, Mona means monohydrate and dumb means dumbbell shaped, because if you look at this crystal, it's a classical dumbbell shape that we have. So remember, the dumbbell shaped one is calcium oxalate monohydrate. And what is the calcium oxalate dihydrate? That is looking like an envelope. So the one which is going to look like an envelope is going to be a calcium oxalate dihydrate. So simple, ma'am, there are 2 calcium crystals. One of them is the envelope wala crystal, one of them is going to be the dumbbell wala. So how will I differentiate in the exam which is monohydrate, which is dihydrate? Mona is dumb. Monohydrate wala is going to be the dumbbell shape and the other one becomes the envelope shaped. Easy to learn. The next one, ma'am, which is the crystal which is going to look or going to have these thorns, spikes? Which crystal has thorns and spikes? So if you zoom into this, you will visualize better. Yes, I can see something is coming out of them. Some spiky thorns are coming out of it. So these are known as apple thorn projections. These are known as apple thorn. A for A. Which crystal am I talking about? Ammonium biurate. I am talking about ammonium biurate, that is A for A. Apple thorn matlab ammonium biurate. Ho gaya. Coming to the second last one, ma'am, the crystal that is going to make us or remind us of a coffin lid. This is reminding us of a coffin lid, right? So you can see there's a line going through and it's like a coffin. So that coffin wala crystal is the triple phosphate. It is the triple phosphate or the struvite crystal. Now I'm going to ask you a surgery question. Firstly, which is the bacteria which is associated with triple phosphate or struvite crystals? Which bacteria? Let me know please. Which bacteria is associated? Very good, I've already got an answer. Proteus. Ma'am, Proteus is responsible for this triple phosphate of struvite crystal, and imagine there are too many coffin lids. They come together. Lots of crystals come together. They are going to make a stone. Which stone is that? When too many of them come together, they make something known as a staghorn calculus. I'm sure you studied this in surgery. Very, very important question. What is the composition definition of Staghorn calculus. Staghorn calculus is made up of triple phosphate or struvite. With which bacteria is it associated? It is associated with Proteus. What is so special about Proteus? Tell me from microbiology, which is that enzyme that it produces, which is making it different from the other bacteria. What kind of an enzyme production does it have? Ma'am, Proteus is urease positive. Proteus is urease positive. So remember, Proteus is going to be urease positive. Okay, having said that, someone also called that Staghorn. I know you can recall that image from surgery. So someone wrote it, ma'am, adrak jaisa. Yeah, I totally agree with you. Anything that works in making you learn, way to go. Okay, coming to the last one, the one that can look like anything, ma'am. You look at this, it is looking somewhat like a triangle, it is looking like a rectangle also, it is looking something weird shape over here. Matlab koi bhi shape, any shape on this planet it is taking up, that is going to be uric acid. So remember, uric acid is going to be universal. Uric acid, I have learnt it this way, uric acid is going to have a universal shape. Any kind of shape is possible with uric acid. So finally guys, all your crystals are done. That is why I had one common chart for the crystals. A very quick 30-second recap. When you're seeing 6 sides, you're going to call it cysteine. When you're seeing thin needles, it is tyrosine. When you're seeing any shape on this planet universal, that is uric acid. When you're seeing A for A, that is ammonium biurate, that is going to be Appleton wala, ammonium biurate. When you see coffin lid, that is triple phosphate. And then you have 2 calcium oxalates, monohydrate and dihydrate. So remember, mona is dumb, monohydrate is the dumbbell shape and dihydrate is the envelope shape. Crystals are done, I hope yes. Right? And now we are only left with one last thing for the day, and that is the casts. So please remember that for the casts, opposite chalenge. First you will answer 2-3 questions for me, then I will teach you the cast. So tell me, which cast am I talking about over here? Which cast am I talking about here? And I'm also getting a lot of requests for other topics. I am anyway planning more sessions, guys. Give me a day or two and I will update you on it, so don't worry. As I said, the first slide that I showed you, that we are in this together. So when I say it, I genuinely mean it. So that doesn't mean that after this I'm not going to meet you anytime till 20th. We are going to have more sessions, so don't worry. Abhi, I'm going in the order of importance. Your mind is also going to get saturated after a while, hai na? So we are going to go in an order of importance, so that beforehand I have all important things done, and then gradually we will move our list of topics ahead. So aaj ke liye I think we've already had a good mind power packed session. All the leukemias are done, all lymphomas are done, now gross images are done, casts are done, crystals are done. I mean 1.5 hour mein more than this, so your mind will not be able to squeeze in. But yeah, all of you have given me a right answer, and that is the classical hyaline cast. I'm not discussing this, I'm just asking you questions right now. I'll discuss it in a minute. Identify the next question. What is the next image that you have over here? Don't worry, micro ka bhi ho jayega, so don't worry at all. Identify the cast, guys. What is this? Both the pictures, what do you want to put it as? This is going to be the muddy brown cast. Very good. Ye wala answer bhi aata hai. Tell me the third question, then I'll explain all of them. Identify this one, please. Is it hyaline, broad, WBC or granular cast? Ma'am, this to everyone can identify. It is such a broad cast. Broad will basically, I will label it as broad. So ab ye kya casts the? Let's do a quick recap and we'll revisit the question. So there are just 5 casts that you have to know, which is going to tell you everything about what is happening in the kidney, inside the kidney. So where am I looking at it? I'm looking at it in the urine. Ma'am, in the urine you will see these casts, and by looking at it in the urine you can guess what is happening in the kidney of the patient. So the first cast that you have looks totally transparent. It's like a transparent cylinder. I will zoom into it and show you. It's like a transparent cylinder. So you can see this. Look at the bigger slide of it. Ma'am, something transparent without any color, hardly dikh raha hai, hardly visible. That is what you call as the hyaline cast. Okay, that is what you call as the hyaline cast. So they will ask you, what is it made up of? What is this transparent thing made up of? It is made up of the TAM horsefall protein. So ye kuch naya protein hai? Is it some dangerous protein? Not at all. TAM horsefall protein you, I and everyone on this planet makes. From where? loop of Henle. So remember, the loop of Henle is going to make a protein called Tam-Horsfall protein. In everyone's kidney, in every normal person's kidney it is made. This Tam-Horsfall protein just comes out in the urine as what? It is going to come out as a hyaline cast. So for example, if you ever send me a report saying, ma'am, patient is showing one hyaline cast in the urine, I'll say ignore kar do, because it's a normal finding. Hyaline cast, if you find 1 or 2 or 3, it's totally normal. It's nothing to be worried about. But if you say that, ma'am, I'm seeing 10, 20 hyaline casts, too many in number, then I would just say that, is the patient dehydrated? Is his urine very, very concentrated? Is he having some high-grade fever? Is the female pregnant? But overall, do you see any medical emergency coming out here which is, like to run for life or death? No, overall hyaline cast is nothing called a medical emergency. It's just a normal kind of a finding. So till the time it is a hyaline cast, you have a smile on your face. You're like, okay, manageable, nothing to worry. But suddenly that transparent structure has something else. It has those red color cells. See, it's the same transparent structure, but something is sticking on top of it now. Red blood cells are sticking on top of it. Now you call it an RBC cast. Which disease shows you RBC cast? It is seen in glomerulonephritis. It is seen in glomerulonephritis. Ma'am, this means kidney mein there is, if I'm seeing RBC cast, this means in the kidney there is a glomerulonephritis happening. Okay, coming to the next. Ma'am, the same hyaline cast, but something else is sticking on top of it. What is sticking on top of it? Some cells, some WBCs, white blood cells are sticking on top of it. So that is going to be the WBC cast. That is WBC cast, and that is what you see in a case of pyelonephritis. Very good, pyelonephritis. So simple. Now ma'am, I've understood. Till the time transparent cast was coming, everything is good in the patient, nothing to worry, chill karo, nothing, no problem. When RBCs start coming, that is a problem, means glomerulonephritis. When WBCs start coming, that means pyelonephritis. But when the cast becomes so dirty, brown, muddy, this is what you call as a muddy brown cast. This is what you call as a muddy brown cast. So muddy brown, why is suddenly the cells are looking all dirty, brown, muddy? Because something is dying. Something is dying, and what is dying? That is ATN. Ma'am, this is a case of acute tubular necrosis. Something is dying. Dead cells will always look dirty only. Acute tubular necrosis. Ma'am, these tubules are dying. When the kidney is dying, obviously all dirty things will come out. That is why it is looking so dirty, and that is why it's looking brown. Finally, the cast, look at this. So broad. Such a mota wala cast. That is what? That is going to be a broad cast, right? And broad cast is going to be what? Broad cast is seen in when the kidney has given up. It's a case of chronic renal failure. It's a case of chronic renal failure, right? Okay, so having said that, now coming back, these were the 5 that I've taught you. What were the questions that I asked you? Question number 1, I asked you what transparent wala. All of you told me correctly, ma'am, transparent wala is going to be the hyaline cast. Next, I asked you that brown, dirty wala. So that brown wala is the muddy brown cast. That is also done. And finally, I had asked you this question. That is the one that is looking big, mota wala. That is the broad cast. And broad cast means the patient is suffering from what? That is going to be chronic renal failure. Okay, so that also marks the end of today's session, guys. So finally, yes, that is done. Also, a lot of you were asking me regarding microbiology. So yeah, you will get an update regarding microbiology, rapid revision, just like we had for this. You will get an update for that, so don't worry. Like I said, that you just need to focus on one thing, and that is your studies. Okay, your schedule, your study. Beech mein kaise path karana hai, you know, how path has to be incorporated, how micro has to be incorporated, how I have to do that, that is entirely my responsibility. So leave that on me. You just focus on what is your part of the job. Your part of the job is bas padhna hai. 10 days, PYQs, images, That is all that you have to do. How and when I have to bombard you and saturate your mind with so many RRs, that I will take care of. Okay? So don't worry about whether it is micro images or anything that path related. वो सब time to time, when the right time, at the right time, on the right day, I will bombard you with a 1 hour session, and that will have too many chapters in it. So that is going to be not only like a confidence booster, but sometimes, you know, passive learning helps, because all of you are sitting in your library at home, or, you know, all by yourself, and it's a very kind of a depressing time where you have 10 days left and there's so much of anxiety. So sometimes, you know, listening to a session does act as a stress buster, because you see 800, 900 students alongside with you, and everyone is saying the same thing as you, that kuch yaad nahi aa raha, bhool gaye. So you feel that, okay, yeah, you're not sailing in some different boat, you're all in the same place. All of us, everyone is studying, but everyone is forgetting. So this is not something that is only unique to you that is happening. Everyone is going through the same kind of situation at this point of time, and that should give you a confidence also that, you know, you are not doing anything different. You are in the same boat, you're doing the same thing, the same content everyone is studying, and we are going to pass also in the same manner. So at least these kind of sessions, I hope they are acting as stress busters and making you revise as well. So yeah, that is what is there. PDF will be there on Telegram, so don't waste your time making notes at this point of time. And yeah, for students who are preparing for later on, obviously a lot of students were asking regarding, ma'am, abhi next has not been implemented, there are going to be changes in it, but yes, the future is definitely going to be next, whether it is the end of this year or whether it is the end of the next year, right? But yeah, so we need to be ready in case you're preparing for future exams. Then in that situation, I think it's better if you start practicing questions in that manner. But abhi at least this year, chances are very, very weak that next would be implemented. But yes, you need to keep yourself ready. And if you still feel that, you know, you want to practice questions, there's nothing better than a, you know, a 10-day free thing. So you can always enroll and you can always, you know, take it up and start practicing questions and get to know, Acha, what exactly is the next pattern going to be. So for that, we've got you covered. You can obviously attempt these questions for free in case you have time and you're not preparing for the Jan 20th exam. Okay. NEET PG students, there is a special separate marathon that is going to be conducted for you guys. Of course, these videos are important for you, but whatever information you need over and above this extra for the NEET exam, there's another marathon after FMGE that is going to be conducted only for you guys also. So you guys have to look at that and benefit from that as well. Okay, thank you so much for joining in, and I will be meeting you soon, of course, multiple times before the 20th exam. But till then, study well, guys. Wishes and blessings are always with you. And any other queries or concerns, do reach out to me. You can comment below or reach out on any of the social media platforms. Thank you so much. Study well. All the very best.
Subscribe and press the bell icon so you never miss an update from PrepLadder. Subscribe and press the bell icon so you never miss an update from PrepLadder.